Hello everybody, Namaste and greetings from my side. Today we want to talk about a very important concept, that is the role and use of robot assistance, that is robotics, in breast cancer surgery. Now if I have a patient who has a early stage breast cancer means that when the tumor is limited to the breast only, a specific part of the breast, upper, lower or inner quadrant. Secondly, the overlying skin, nipple or the underlying chest wall is not involved. Also, all those patients who initially had an advanced breast cancer, but after that they were given chemotherapy or chemo with targeted or chemo with immuno, and they got a very good response. So all these patients become eligible for skin sparing or a nipple sparing procedures. What does nipple sparing or skin sparing means? That is, we preserve the overlying skin and the nipple, if possible, of the breast, and we go beneath that and remove the tumors or the affected part of the breast. So in this way, what we do, we preserve the sensation of the breast. So as you all understand, nipple is the most sensate part of the breast, and then comes the skin. So basically the breast which is preserved after breast cancer surgery is a sensate breast, is a functional breast, and that is where the robot comes into the picture. So through robot, we are able to if I want to do a nipple sparing procedure through a circummandibular incision, that is, I give a small incision, we dock the robot goes inside the breast and helps us in removing the affected part or the whole of the breast in a much better way. The skin is preserved better, there is no scarring, the limited scarring, there is no ischemia of the skin, so that the sensation remains much better. Also, if I have to go from the lateral part or the inferior part, so that part also I give a small incision and we are able to go inside the breast and remove the affected part or the whole breast. So this gives an added advantage when we do all these procedures, and the results are much better. Also, if I am doing a kind of a small procedure of a small removal of the lump, so we remove the lump or the affected part, and through robot only we are able to manipulate the rest of the breast and bring the tissue at the defect, so that the defect is reconstructed. The other part is that if I have to use a large flap, that is a lattice mesh flap, also I can just go from robot, through the robot we can assess the whole of the back or the lateral part, bring tissue from that part into the breast without even giving any incision at the back or even changing the position of the patient. So this gives us very good results. So basically the tumor removal is much better. The surgery becomes less morbid, there is no blood loss, the overlying skin, muscles and the nerves are preserved very well, and also the reconstruction part becomes much simpler and easier. So the patient comes in with breast cancer, goes out with a normal and a functional breast, which is as normal as anybody else would have. Thank you.